I'm sorry, but we need $3,200 upfront or your daughter cannot receive treatment today. Jennifer Martin stared at the billing clerk through the thick glass window, her brain refusing to process the words. Her 5-year-old daughter Emma sat in the wheelchair beside her, bald from chemotherapy, wearing a pink princess dress. "I want to look pretty for the medicine, Mommy," and clutching a stuffed rabbit named Mr. Hoppy. Emma had acute lymphoblastic leukemia. The most common childhood cancer. 90% cure rate with proper chemotherapy. But proper meant 12 scheduled infusions over 6 months, each costing thousands. And Jennifer was a 29-year-old single mother working part-time at CVS for $13.50 an hour while driving Uber whenever Emma's grandmother could babysit. "I have Medicaid," Jennifer said, voice shaking. The social worker said it covers Emma's treatment. Medicaid covers a portion, but copays, facility fees, and certain medications fall outside coverage. Your account shows $47,382 in outstanding medical debt. Hospital policy requires today's copay before treatment. $47,382. Jennifer had been making $25 monthly payments, all she could afford, but the debt grew faster than she could pay it. Every test, every scan, every medication Emma needed to stay alive was another bill crushing her. "I don't have $3,200. Jennifer's hands trembled. "I have $140 in my checking account for groceries and gas this week. Can I make payments? I get paid Friday." Hospital policy is payment or approved payment plan before treatment. "But she needs this today." Jennifer's voice cracked. She tried not to cry in front of Emma, who watched with those huge brown eyes that saw everything. Her oncologist scheduled this. It's part of her protocol. Every 2 weeks. Today is day 14. If she doesn't get it, the cancer. "I understand this is difficult, but I don't make the rules. You can speak with financial services about payment plans or try County Hospital. They have more flexible policies." County Hospital was 40 miles away. Emma would miss today's treatment window. And flexible meant worse care, overwhelmed staff. Phoenix Children's Hospital was ranked number 3 nationally for pediatric oncology. "Please," Jennifer whispered. "She's 5 years old. She has cancer. I work 2 jobs. I'm doing everything I can. Please don't tell me my daughter can't get cancer treatment because I don't have $3,200. I'm truly sorry, but I can't override policy." "What's wrong, Mommy?" Emma asked, her small voice cutting through everything. "Am I not getting my medicine today?" Jennifer knelt beside the wheelchair, forcing a smile. "We're just working out some details, baby. It's okay. But I need my medicine," Emma said matter-of-factly. At 5, she understood chemotherapy kept the bad cells from winning. She'd been brave through everything: blood draws, port access, nausea, hair loss. Never complained once. "I know. You'll get your medicine. I promise." Jennifer didn't know how she'd keep that promise, but she'd figure it out. Beg, borrow, max out credit cards she didn't have. Anything. In the corner of the waiting room, Dr. Rebecca Walsh had been listening to the entire exchange. Dr. Rebecca Walsh was 53, a pediatric oncologist who'd worked at Phoenix Children's for 26 years. She'd chosen oncology to save children. Stayed despite heartbreak because with leukemia, she usually could. She'd overheard everything. The desperation. The impossible choice. $3,200 or your daughter dies. Dr. Walsh made $280,000 a year. Not wealthy, medical school debt, mortgage, her teenage son's college fund, but comfortable. She'd never had to choose between food and medication. Never begged a hospital to treat her dying child. She stood, walked to the billing window, and interrupted. "Excuse me. I'm Dr. Walsh, pediatric oncology. Are we discussing Emma Martin's treatment?" The clerk looked relieved. "Yes, Dr. Walsh. The mother doesn't have today's copay. I'll cover it." Dr. Walsh pulled out her wallet. $3,200. "Put it on my credit card." Jennifer turned, shocked. "What? I'll pay Emma's copay. She's my patient. She needs chemotherapy today. Let's make it happen." Jennifer was crying openly now. "I can't let you do that. That's too much money. I'll pay you back, I promise." "You don't need to pay me back," Dr. Walsh said gently. She looked at Emma, tiny, bald, princess dress, stuffed rabbit, and something in her chest broke and mended simultaneously. "Emma needs treatment. That's what matters." Dr. Walsh handed her card to the stunned clerk, who processed the payment in silence. Treatment approved, the clerk said quietly. Jennifer grabbed Dr. Walsh's hands. Thank you. You just saved her life. I'm just doing what I should have done a long time ago, Dr. Walsh said. Because this wasn't the first time she'd seen a family destroyed by medical bills. Just the first time she'd personally intervened. After Emma's successful chemotherapy session, Dr. Walsh asked Jennifer to talk privately. Tell me about Emma's father, Dr. Walsh said gently. He left when I told him I was pregnant. I was 23. He said he wasn't ready. No child support. No contact. Nothing. And your family? My mom helps when she can. She lives 2 hours away. But she's on disability from a back injury. Can't help with bills. My dad died when I was 16. No siblings. It's just me and Emma. And the $47,000 in debt. Jennifer laughed bitterly. Emma was diagnosed 8 months ago. I have high-deductible insurance through CVS, $6,000 deductible, 40% coinsurance after. Do you know how fast you hit $6,000 with childhood leukemia? The first-year visit. She showed Dr. Walsh her phone tracking every bill. Over $101,000 billed in 7 months. Insurance paid $59,000. Jennifer owed $47,382. I'm making $25 monthly payments. It's all I can afford. I make $1,800 after taxes, $100 from CVS, $700 from Uber. Rent is $950. Utilities $150. Food $300. Gas $200. Car insurance $80. That's $1,680. I have $120 left for everything else. How do you survive? I don't eat much. Skip meals. Emma eats. I make sure she has everything. I lost 30 pounds since July. Not on purpose. Just not enough money for both of us. Dr. Walsh felt sick. This mother was starving herself to keep her daughter alive. And the hospital demanded $3,200 before treating a 5-year-old with cancer. Jennifer, I want to help. Not just today. Long term. Will you let me? For the next 2 years, Dr. Walsh became Jennifer's anonymous guardian angel. She paid every copay, every chemotherapy, imaging, lab work, clinic visit. She set up billing alerts, paid immediately, told them not to notify the patient. Jennifer would receive statements showing $0 balance. Assumed insurance covered more than expected. Over 24 months, Dr. Walsh paid $88,800 for 18 chemotherapy sessions, 8 imaging scans, 24 clinic visits, medications. She told no one. Not her husband. Not colleagues. This wasn't about recognition. This was about a 5-year-old deserving life-saving treatment regardless of her mother's bank account. She also connected Jennifer with charity care programs, pharmaceutical assistance, nonprofit grants. Slowly, Jennifer's $47,000 debt was forgiven through applications Dr. Walsh helped complete. January 2027, 2 years after that first payment. Emma, now 7 with a full head of curly brown hair, sat in Dr. Walsh's office getting her 2-year scan results. Emma, Dr. Walsh smiled, you're officially in complete remission. No cancer cells. You're cured. Emma jumped up. I beat the bad cells. Jennifer sobbed. 2 years of terror. And now, cured. Thank you for everything, Jennifer said. For saving her. For that first day when you paid. I never forgot. I paid you back, by the way. Took 2 years, but I sent you $150 every month. Last payment was this month. $3,600 total. Dr. Walsh's smile froze. Jennifer had been paying her back, while Dr. Walsh had been secretly paying $88,800. Jennifer, you didn't have to. Yes, I did. You saved my daughter when the hospital said no. That debt was sacred, more important than any other bill. Dr. Walsh realized Jennifer had been sending $150 monthly for 2 years, repaying the one payment she knew about, while Dr. Walsh covered everything else invisibly. Jennifer, can I tell you something? That first payment wasn't the only time I helped. For 2 years, every copay, every bill, I paid them all. You never got those bills because I paid them before they reached you. $88,800 total. Jennifer stared. What? I couldn't let a child go untreated because of money. I couldn't watch you destroy yourself. So I paid them quietly. I didn't tell you because I didn't want you to feel obligated or ashamed. I wanted Emma to get treatment without you choosing between her life and financial ruin. Jennifer was crying. hands over her mouth. Why would you do that? Because I could, Dr. Walsh said simply. I make good money. I don't have medical debt. I could afford it. And you couldn't. But Emma deserved treatment just as much as any child whose parents have money. So I paid. Not because you owed me. Because she deserved life. I don't know what to say. How do I thank you? You don't. Take those $150 monthly payments and save them for Emma's college fund. She's going somewhere. Smart girl. Cancer survivor. She'll do amazing things. The $3,600 I paid you. I'm donating it to the hospital's financial assistance fund. So the next family gets help. You'll help someone else's child. That's how you thank me. 5 years later, 2030. Emma was 12, cancer-free for 7 years, planning to be a doctor, like Dr. Walsh mommy. I want to save kids like she saved me. Jennifer was 36, working full-time as a hospital pharmacy technician, $22 per hour, benefits, no longer drowning in debt, saving $200 monthly for Emma's college. Dr. Walsh was 58, still treating children, still quietly paying bills for families who couldn't afford them. 16 families over 8 years. Over $400,000 of her own money. Her husband finally knew. She told him in 2028. He'd cried and said he'd never been more proud. Jennifer volunteered every Saturday at Phoenix Children's, talking to newly diagnosed families, helping them navigate financial assistance. When we couldn't afford treatment, a doctor paid. Let me help you find resources too. The cycle of kindness continued. What Dr. Walsh never told Jennifer. Her younger sister Rachel had died at 32 from breast cancer. Not because the cancer was untreatable. Because Rachel had no insurance, delayed getting the lump checked for 8 months because she couldn't afford the mammogram. By the time she went to the ER, it had metastasized. Stage 4. Inoperable. Rachel died because she couldn't afford health care. Died waiting for treatment she could never pay for. Dr. Walsh became a doctor to save children like Emma. But she paid bills to save mothers like Jennifer. To honor sisters like Rachel. To rebel against a system that let people die for lack of money. Every time she paid a family's bill, she thought, Rachel deserved this too. I couldn't save Rachel, but I can save Emma. And the next child. And the next. Jennifer Martin's story reminds us, in the richest country in the world, parents watch children die because they don't have $3,200. Cancer doesn't care about bank accounts, but apparently, treatment does. Childhood leukemia has a 90% cure rate, if you can afford treatment. If you can't, your child dies of a curable disease. That's not medicine. That's murder by billing department. Dr. Walsh isn't a hero. She's an indictment. The fact that one doctor spent $88,800 of her own money to keep one child alive exposes the moral bankruptcy of American healthcare. No parent should beg for their child's life. No child should die because their mother works at CVS. No doctor should secretly pay bills to ensure patients survive. Like, subscribe, and share if you believe healthcare is a human right, not a privilege. Join the conversation. Have you been denied treatment because you couldn't pay? Or watch someone suffer from medical debt? Share your story below. Remember, Emma survived because one doctor paid $88,800. But thousands of children don't have a Dr. Walsh. They just have debt and dying children. Support universal health care. Support medical debt forgiveness. Support children living.